and I was pregnant, and so I didn't want to work, and we were pretty low census because we did a lot of like back surgeries and stuff that were like planned, so we stopped doing planned surgeries, so our census was real low, so we could get flexed off. And so I requested to get flexed off because I didn't want to take care of a COVID positive patient while I was pregnant with only a simple mask. And the first day that I was flexed off, I got a phone call from my manager, and she was like, because she knew how I felt, and they were trying to be super nice about it, because, you know, and she asked me, and so by this time I did have my master's, so she asked me if I wanted to be a part of a COVID call center, triage call center. So this hospital had a big triage call center already, where patients could call in. They get triaged based on a triage system, and then they're told what to do, basically. There's a little bit of medical information they'll give them over the phone, but usually they'll tell them you need to make an appointment with your doctor, or you need to go to urgent care right now, or you need to go to the hospital, or you need to call 911. Like, what is safe for you based on your symptoms? And so they opened up like a little cubicle space for COVID, and they staffed it with hospital nurses that were being flexed off. And so I was like, yeah, I'll go there. So I was working triage phone lines, which is something I never, ever expected to work in a cubicle, right? And so I had my own little cubicle space, which because they had to keep us all social distanced, and a headset, and I answered phones all day. And it was before the 211 San Diego County had their own like line set up, so they didn't. So we had calls, and we had people waiting to talk to us on our lines for like 2.5 hours backlogged from the moment I sat down to like, so it was just one call after.
Health questions, fear. So many people were so afraid, and it was wild. And finally it did slow down a little bit when the 211 in the county opened their own call center, so that was cool. But I mean, we would come into work, and like the answers to the questions from the day before would be completely different because the CDC would be giving us new information every day. So everybody was getting super frustrated with it. And so it was like, it was a really interesting job to see triage, like online or like phone triage, which I'd never seen or thought of, like didn't realize that's like truly nursing. Like everybody that worked there full time are nurses, right? And so it was kind of interesting. But so we did that. And then once we didn't become as needed because COVID was kind of a little bit more contained and there wasn't quite as much fear, and the county had lines open for different things, then we cut back a lot of the nurses. So we had, I don't even remember, but probably something like 50 nurses, like all the time answering phones with a 2-hour long wait list. And then we cut everybody back. And they invited a few of us to continue something called COVID Care Companion. And so I was really lucky, and that's why I say everybody should get their education, because I never thought I was going to be in a phone center. But if I didn't have my master's, I would have been invited to do the COVID Care Companion. And for me, to do the COVID Care Companion was so important because I was not ready to go back to bedside because I was still pregnant. COVID was still there. We had a huge shortage of PPE in San Diego County. So I could go back to the hospital unprotected, or I could continue working in a cubicle throughout my pregnancy and be a COVID Care Companion nurse. So we did that, and it was cool. And it was a group of maybe like 6 or 8 of us, I can't remember. And they got some IT people from the hospital and designed this app for home monitoring of COVID symptoms. And then every patient that came through the hospital with COVID, we followed them after the hospital through this app. They didn't have to, they could opt out, but if they wanted to, we taught them how to like check their vital signs and their symptoms, and every day they would go on their app and click in their symptoms through this checkbox. And then every morning when we came in, we would review everybody's symptoms that they had sent in, and we would call them if there was concerns, and we would just basically monitor them that way. And then for people who hadn't filled out the app in a day, we would call to do check-ins on them. And it was pretty cool because we did a few times have to send ambulances to people's houses who didn't fill and didn't answer their phone, and they were patients that were like found down by the ambulance that they wouldn't have even been notified that there was an issue had we not been following them. So it was pretty cool. Like, it was a really cool
like.
How do you know they were down?
But just because we couldn't get a hold of them, so we
Are you
expected,
serious?
we expected that they fill out their, because they agree to it when they want to be a part of the program. So they needed to fill out their symptomology every day, and then once they got better, we would put them on like an every other day plan. But if they weren't filling it out, and they're supposed to be on an everyday plan, we would call them, and if we couldn't get a hold of them after 3 phone calls, then we would call for a wellness check. And so they would go check on them, and we had some that were living in hotels, like COVID. If you remember that some of the hotels were COVID sanctuary hotels, so they would send patients there to isolate in the rooms that had COVID, and they would send a nurse to the hotel to check on those patients in the individual rooms. And so some of the places, if our patients, if they were like not responding, we could send the nurse to their room, but the ones that were living at home, we just had to do wellness checks on them. It was pretty crazy. But remember, COVID was really serious, and everybody was so scared that most of our patients were super compliant. And the ones who didn't want to be any part of that, it was totally voluntary. Like, it was no problem. We'd be like, do you want to be a part of COVID Care Companion? And some would be like, no way, I'm fine.
Yeah.
Okay, cool. And other ones were fine, and they still wanted to do it because they were so scared. And so it was like, those ones that wanted to do it were usually really diligent about doing the self-assessment.
You're giving me flashbacks right now.
It's weird.
Like
It's weird
2021.
stuff that was going on, yeah. Especially knowing, like, now what we know, right? But we didn't know what it was going to turn into.
Yeah.
And so, kind of interesting. So I did that, and then after that, I came back. I came back, and I started teaching at Cuesta.
How'd that happen?
So I like teaching. I always liked teaching, but I used
You're good at teaching.
That's nice.
You were like, I would say, like you were one of everybody's favorite teachers, 1000%.
I don't know about that, but thanks.